good morning. I'm Ana González, a researcher at the Universidad Politécnica de Madrid, part of the Information Processing and Telecommunication Center, and I'm going to present you the paper, An Analysis of Usage and Reporting Patterns in a Mobile Health Application.
The use of mobile application as a tool to monitor health-related parameters is now a common practice. This application usually tracks the users by retrieving relevant information from mobile embedded sensors, but also from self-reported data. To make sense, this application requires that users remain active in the use of the application to get the most complete data records. This means that users need to have a good adherence to the app. This work aims to understand how users behave with mobile health application. We also explore the concept of adherence of the users to this application and how to improve it. Finally, we will focus on the impact of notification, which is the main adherence strategy of the use case to be approached.
First of all, it's necessary to understand the basic concepts surrounding this work. Mobile health. Mobile health is defined as a medical and public health practice supported by mobile device. One of its most important and usual component is mobile application, or app. A mobile health app has a huge potential. It can support clinical decisions, detect abnormal patterns, provide support for healthy behavior change, or provide information to handle chronic disease, and many other usages. This is the usual structure of a system based on an app. It has a backend to connect the interface oriented to the doctor and the mobile application oriented to the patient. There are more than 50,000 of medical apps in its marketplace oriented to a multitude of health contexts. But for a proper operation of this system, it's necessary to collect as much data as possible to be processed and delivered to the professional. Data can be collected passively, direct through the mobile device, or actively through patient's interaction with the application. To get the most out of this system, it's important that active data is sent frequently and as much as possible. In other words, it's important that the patients have a good adherence to the application. Therefore, we have analyzed the different mechanisms used in the literature for this purpose. The most common mechanisms are: provide relevant information about health or disease, personalized goals, developing strategies to motivate patients to achieve goals in order to improve their habits and health status. Provide feedback about their progress, for example, through motivational messages aimed to encourage the patient to keep improving. Show evaluation of the self-data, for example, through graphs or notes. Delivery of notification and reminders, for example, to remind about take medication or to input data. And finally, connect patients with similar circumstances to support and motivate each other to keep improving. It's important to remark that there are other mechanisms, but these 6 are the most usual in the literature. This work is built around a mobile application used to monitor young patients with mental health conditions. The system pretends to monitor patients' mood in order to allow the doctors to monitor them and prevent mental health issues. To this end, there are 2 main components: mobile application for patients and a practitioner dashboard. The app monitors patients' condition through passive data, as information about their activity collected from mobile phone sensors, and active data, emoticons which represent feelings. The user must report this type of data ideally several times per day. The dashboard provides relevant information to the therapist during the session with the patient. To achieve data security, patients must actively award access to the data during the therapy. Moreover, the system backend provides storage, processing, and securitization features. It also includes a notification module, which is the one in charge of dispatching apps prompt to the application user. To incentivize adherence, the application implements some of the previous adherence mechanisms. Notifications are the main mechanism to keep the user active in the app. The system sends 5 daily notifications and we will then analyze the effectiveness of this mechanism. A total of 20 users participated in the trial. They are young, without any specific diagnostic, but with interest in being able to access tools for their self-management of their mental health. These patients are requested to use the app for 1 month. In order to analyze the results, 4 different types of data are collected. First, data directly related to adherence. In this system, adherence is measured in terms of how many emoticons are sent and how often they are sent. In addition, the user sends along the emoticons information about where and with whom they are, which is used to analyze the context in which patient used the app. And being interested on the effects of notification, we divide the day into slots to calculate the number of emoticons sent within each. This slot takes account of the hours of the notification, as we can see in the figure. We also compute the time difference between when notification was received and when the user sent the emoticon. This time is going to be understood as the average reaction time to its notification. With the data analysis, we get notice that the users saw different patterns in the use of the application. Regarding active data, the volume of emoticon is much lower as expected, but with huge difference between the patterns. A total of number records per user range from 9 to 115, with an average of 65, but with a standard deviation of 50. This variability in the number of reports is related to the adherence itself. Taking as basis the volume of frequency of reports, we can distinguish 2 different types of users. On the one hand, a group of 7 users who report emoticons every day of the trial. On the other hand, the rest of the users who are less methodical, showing inactivity periods, even of a week, and reporting less emoticons per day. This split has also confirmed by the cluster analysis carried out. We also analyze the use of both type of users, and we see emoticons is usually sent more alone and from home. Finally, we analyze the response of the users to the notification to evaluate their effectivity in each group. We observe clear difference between the users who report emotions every day and those who not do it. Users showing greater adherence have a uniform distribution of emoticons through the day, with almost no nighttime sendings. Meanwhile, users with more irregular adherence send more emoticons on the first half of the day, and in their interaction decrease as the hours go by. In addition, this type of users send more emoticons at the night. We also analyze the average time difference between a reminder and the next emoticon to analyze the reaction time towards a notification. Group 1 reacts equally to all 5 notifications. Meanwhile, in the second group, we perceive better feedback to notification in the morning. For the rest of notification, users almost never respond within half an hour time. With these 2 graphics, we can see the big difference in each group and the form to interact with the application. With the analysis, we can ensure that notifications are an effective mechanism. 70% of the users respond them in less than an hour. However, the notifications are more effective for users with great adherence and are not enough for more inactive users. To conclude, it's important to remark that the analysis has been limited by the small number of users and data. However, it is useful to build a base for understanding the usage patterns of this type of application and how to improve it. It has been observed that not all users respond in the same way to the same design. The objective will be to design personalized measures to foster adherence during inactivity periods and to guarantee timely reporting along the day. With regard to the notification, its frequency could be customized according to the user's needs. It could improve the adherence of the users to the application. Finally, it's interesting to include other adherence mechanisms to incentivize the most inactive users because they need more than only the notification as adherence mechanism. The progress of this kind of technology could have huge benefits for healthcare. For this reason, it's important to continue research in this field to optimize the user experience with mobile health application. As we have seen, the user relationship with the application has a strong implication for the results that can be expected from these systems. Our team will continue to explore how to improve user adherence to obtain an adequate volume of data to achieve meaningful results. The main objective is that all patients use the application properly, and they can be more involved in taking care of their health treatments.